honey has had magical powers over many centuries, and many cultures have been using it for medicinal things. And so, again, we use it sometimes in small children for a cough because it seems to work just as well in children and maybe adults too as some of the over-the-counter cough medicines. And so it can be used for cough. It can be used to help reduce heartburn in people. People usually take it with, they have seasonal allergies because if it's a local honey, it kind of desensitizes people who have allergies if it's a local honey. So if you eat honey from some other place and it's different than the pollen in the area that the person lives, it may not work. So it has to be a local honey in the place that you are at that moment. It has many minerals, has vitamins, B vitamins, vitamin C, so it has some nutritional value as well. But for us, we use it for wound care. And Mede honey is from a certain place, Australia and New Zealand. So it's not some just any old honey, it's actually from this region that makes this a magical mixture or component. And so it works by three different mechanisms. So honey is really concentrated. And so I remember seeing a video where the bees actually use their wings to fan it so that it gets more concentrated by evaporating some of the fluid. So it's very concentrated. So when you put it on a wound, it will draw out the fluid. And so it will kind of debride and draw out the fluid. So that's property number one. Number two is because it has sugar and it has other nutrients, it can actually help feed and revitalize and grow new tissue. So supposedly if you use Mede honey, the nutrients in the honey helps to grow tissue 4 days faster than if we used anything else. So it's feeding the tissue that's trying to grow. And the third thing is that it actually is an antibacterial. So it's mainly because of the pH of the honey. So pH is somewhere around 3.5 to 4. So the acidity of the honey will kind of kill the bacteria. And it works so well that it will start killing the bacteria within 30 minutes that you apply it to. And it works against MRSA, VRE, so a lot of the bacterial resistant germs are still killed by this honey. Now other honeys also are acidic, but it depends on the pollen that the bees use to make the honey. So some pollen actually makes alkaline honey, and some make it acidic. So it really depends on which pollen the bees use. But in this area of New Zealand and Australia, it's ideal for this magical honey to be made. So that's Mede honey. So we use it, and there's a lot of data that actually says it does work. So the other benefits are that it's not usually allergic causing, so it's more well tolerated than some other chemicals. If you use it around people's eyes or babies, it's safe. If they got in somebody's eyes, it wouldn't be so dangerous. And the more you use it, there's no resistance risk of the bacteria. There are studies done, so it's not just hand waving, there's studies. There are 327 patients that there was an 87% wound reduction in 4 weeks in the size, compared to 52% by using other means. So it seems to close up wounds faster than other modalities that we use. They looked at 112 kids, and there was a 4-day increase in healing compared to sulfa drugs and sulfasalazine. And so it seemed to work better than some of the other wound cares that we use. And it works really well in diabetic foot ulcers. So the lot of studies that are there that says this is not just kind of a home remedy that doesn't work. There's data that says it does work with wound care. So something to keep trying and